I will now begin the first round of questions, limited to 5 minutes for each member. If there are additional questions following the first round, we'll have additional rounds of questions as needed. Mr. Dink, the Center for Rural Pennsylvania has done a lot of work for the Pennsylvania General Assembly. It seems the impact of the opioid crisis on the workforce is significant. From the information the center has gathered, can you highlight how opioid abuse has created barriers for attracting jobs, and how will the General Assembly use the information you collected to address this issue?
We have heard from a number of testifiers, particularly those in recovery, where prior felony convictions still linger for them, not just in employment opportunities, but with regard to public or housing itself. And so I know my boss, Senator Gene Yaw, is looking at that issue. There is concern that those felonies, while committed because somebody was addicted to a substance, that needs to be looked at, and at some point in time, maybe that can be removed from their record. We heard from one young individual in Greensburg, Pennsylvania, started the path into drugs at age 13 because of her home environment. And she eventually went to heroin. She committed 2 felonies by the age of 20. That woman turned her life around completely. She now has a master's degree, and she now works for the Allegheny Health Network as an addictions counselor, helping individuals. Those 2 felony convictions still linger on her record, and she has been turned down for housing because she reports, yes, I've been convicted of 2 felonies. So we've heard that. We have heard from employers, particularly in the gas industry, which is important to Pennsylvania's economy, with the drilling of individuals who fail to pass some drug tests. We heard at one of our hearings in Williamsport, where the local single county authority, the agency that provides treatment services, they are meeting with employers and developing a list of employers who are willing to give a second chance to an individual who may have had a substance use disorder, may have had some kind of criminal activity as a result of that. We also heard from a number of judges about the effects of drug courts. And how helpful they are in somebody who has committed a crime but needs to turn their life around. And so we're looking to expand drug courts across the Commonwealth. Currently, out of 67 counties, only 38 drug courts exist in those counties. A number of things that are being looked at to further document the question that you raise and take a look at it from a legislative standpoint as to what might be done.
Thank you. Ms. Hale, Operation Unite has done a lot in eastern Kentucky and has become a resource for other communities. What types of programs have you found to be the most impactful in addressing the opioid crisis, and are there models that other states like Pennsylvania can use?
I think our education prevention programs have had the greatest impact. We have seen and heard anecdotal evidence from some of our summer interns who are students in college share that on their college campus, in attending frat parties and sorority parties where there unfortunately is a great deal of alcohol and drugs being used at the parties, the students have noted that there are a number of students who do not engage in those activities, and then they begin noting that those students were from eastern Kentucky and have grown up for the last 10 to 12 years hearing about substance abuse, being trained in making healthy choices and things such as that. We're seeing an impact on that generation. Also, we're seeing an impact in our programming in working with the Administrative Office of the Courts through our drug court programs. We are learning that drug courts do work. There are many people who are in recovery who make excellent employees because of what they have endured, what they now understand, the structure that has been brought into their lives through the drug court programmings. Education and prevention. We have a mobile prevention unit that we target 7th and 10th graders. That has had a huge impact. The University of Kentucky compiles the data from the pre and post surveys with that program. We also have programs that we're taking into the elementary schools where we are introducing young people at an early age to the dangers, the harms, preparing them with knowledge, helping them make healthy decisions, even as early as 3rd grade. And then, of course, our AmeriCorps program. We have 54 AmeriCorps members serving in 13 counties in our district. And those AmeriCorps members work primarily on math tutoring, but they also are introducing a Too Good for Drugs curriculum that impacts the parents, the staff, and the community in prevention initiatives.
Thank you.